Hello friends, welcome to ICU Nurse YouTube channel. At synapses, the space between pre and postsynaptic neuron is known as A. Synaptic knobs, B. Synaptic cleft, C. Synaptic vesicles, D. Schwann cells. And the correct answer is B. Synaptic cleft. Synaptic cleft is the space between neurons at a nerve synapse across which a nerve impulse is transmitted by a neurotransmitter. Synaptic cleft is also called synaptic gap. Gradually increasing pain, weakness and numbness in the hand or wrist that radiates up the arm suggest A. Amyotrophic lateral sclerosis, B. Carpal tunnel syndrome, C. Bell's palsy, D. Dystonia. And the correct answer is B. Carpal tunnel syndrome. Carpal tunnel syndrome is a common condition that causes pain, numbness and tingling in the hand and arm. The condition occurs when one of the major nerves to the hand, the median nerve, is squeezed or compressed as it travels through the wrist. Huntington's disease is a heritable disorder that involves A. Sudden paralysis, B. Chorea, loss of cognitive abilities and emotional disturbance, C. Repetitive actions, D. Inability to recognize faces. And the correct answer is B. Chorea, loss of cognitive abilities and emotional disturbance. Huntington's disease is a progressive brain disorder that causes the degeneration of the cells in a pair of nerve clusters deep in the brain. The disease affects both the body and the mind. Huntington's disease is caused by a single dominant gene and affects men and women of all races and ethnic groups. It generally begins during the third and fourth decades of life. However, there is a form of the disease that can affect children and adolescents. Symptoms of Parkinson's disease include all of the following except A. Tremors of the hand, arms, legs, jaw and face, B. Stiff limbs, C. Bradykinesia and impaired balance, D. Impaired cognition. And the correct answer is D. Impaired cognition. The four characteristic symptoms of Parkinson's disease are tremor, rigidity, slowness of movement and postural instability. Tremor is generally most apparent at rest or when the patient is stressed or improves with deliberate movement. Difficulty speaking and understanding speech is termed as A. Apnea, B. Ataxia, C. Aphasia, D. Dyslexia. And the correct answer is C. Aphasia. Aphasia results from damage to the portion of the brain involved in creating and interpreting language. Aphasia is not a disease. It is a symptom of a neurological disorder or injury such as stroke, brain tumor or head injury. Amyloid plaques and neurofibrillary tangles are the hallmarks of A. Alzheimer's disease, B. Amyotrophic lateral sclerosis, C. Ataxia, D. Autism. And the correct answer is A. Alzheimer's disease. Narcolepsy is a disorder characterized by A. Narcotic abuse, B. Grand mal seizures, C. Reliance on sporadic drugs, D. Inability to regulate sleep-wake cycles. And the correct answer is D. Inability to regulate sleep-wake cycles. Narcolepsy is a neurological disorder that causes affected individuals to experience irresistible bouts of sleep, causing them to fall asleep for periods ranging from seconds to minutes throughout the day. Along with excessive daytime sleepiness, persons with narcolepsy also suffer from cataplexy, hallucinations at the onset of sleep and/or upon awakening, and transient complete paralysis at the onset or end of sleep. The structure by which the anterior horns of the left and right lateral ventricles of the brain are separated is known as A. Node of Reinwehr, B. Septum pellucidum, C. Cerebellum, D. Spinal cord. And the correct answer is B. Septum pellucidum. A severe form of epilepsy that appears during the first year of life is called A. Dandy-Walker syndrome, B. Devick's syndrome, C. Dravet syndrome, D. Fabry disease. And the correct answer is C. Dravet syndrome. Dravet syndrome, previously known as severe myoclonic epilepsy of infancy, is a type of epilepsy with seizures that are often triggered by hot temperatures or fever. It is treated with anticonvulsant medications. It often begins around 6 months of age. Lack of ceramide trihexosidase, also known as alpha-galactoside A, causes A. Farce syndrome, B. Fabry disease, C. Fisher syndrome, D. Gaucher's disease. And the correct answer is B. Fabry disease. Fabry disease is a rare genetic disease with a deficiency of an enzyme called alpha-galactosidase A. The disease affects many parts of the body, including the skin, eyes, gastrointestinal system, kidney, heart, brain, and nervous system. What is the function of arachnoid villi? A. To reduce pressure on the central nervous system, B. To increase the pressure on the central nervous system, C. Controls visual acuity, D. Helps in sphincter control. And the correct answer is A. To reduce pressure on the central nervous system. The function of arachnoid villi is to reduce pressure on the central nervous system, particularly in the areas of the upper spine, brainstem, and part of the midbrain. Treatment for epilepsy to eliminate or sharply reduce the frequency of seizures may involve all of the following except A. Cognitive behavioral therapy, B. Narrow spectrum and broad spectrum anti-epileptic drugs, C. Vagus nerve stimulation, D. Surgery. And the correct answer is A. Cognitive behavioral therapy. People with epilepsy, especially children and adolescents, may develop behavioral or emotional difficulties in response to stigmatization. Cognitive behavioral therapy may be considered as adjunctive therapy It is not, however, a treatment for the seizure disorder, which is for the majority of affected persons is controllable with the use of anti-epileptic drugs. Brainstem is formed by except A. Midbrain, B. Cerebellum, C. Pons, D. Medulla oblongata, and the correct answer is B. Cerebellum. The brainstem is made up of three major structures: the medulla oblongata, the pons, and midbrain. Cerebellum is not a part of brainstem. The fluid which acts as a cushion for brain and spinal cord is A. Bile, B. CSF, C. Plasma, D. Peritoneal fluid, and the correct answer is B. CSF, cerebrospinal fluid. The cerebrospinal fluid acts as a shock absorber cushion for the brain and the spinal cord. It is a clear, colorless fluid which is found in the areas of the brain and the spinal cord. It acts as a mechanical barrier against all forms of shock. The fluid supports the brain and also acts as a lubricant for all the surrounding bones. The structure by which two hemispheres of cerebrum are connected is known as A. Septum pellucidum, B. Arachnoid villi, C. Corpus callosum, D. Convolutions, and the correct answer is C. Corpus callosum. The cerebrum is the upper front portion of the brain and consists of two hemispheres or halves. The two hemispheres are connected by the corpus callosum, which is a large bundle of nerve fibers. Primary motor cortex is found in which part of the brain? A. Frontal lobe, B. Parietal lobe, C. Temporal lobe, D. Occipital lobe, and the correct answer is A. Frontal lobe. The primary motor cortex or M1 is one of the principal brain areas involved in motor function. M1 is located in the frontal lobe of the brain along a bump called the precentral gyrus. The somatosensory area of cerebral cortex is found in A. Frontal lobe, B. Occipital lobe, C. Parietal lobe, D. Temporal lobe, and the correct answer is C. Parietal lobe. The primary somatosensory cortex is located in a ridge of cortex called the postcentral gyrus, which is found in the parietal lobe. A baby starts to run at the age of A. 9 months, B. 7 months, C. 18 months, D. 15 months, and the correct answer is C. 18 months. At 18 months old, your toddler may be able to get up a bit of speed when he is toddling, but running will take all his concentration. He will only be able to run in a straight line and won't be able to run around obstacles that get in his way. Hirschsprung's disease is most commonly associated with A. Pyloric stenosis, B. Down syndrome, C. Tuberculosis, D. Turner syndrome, and the correct answer is B. Down syndrome. Hirschsprung's disease, a congenital condition in which the rectum and part of the colon fail to develop a normal system of nerves, leading to an accumulation of feces in the colon following birth. A baby presents following features: ear pain, irritability, excessive crying, and pulling or rubbing the ear. The baby is suffering from A. Otitis media, B. Deafness, C. Sinusitis, D. Brain tumor. And the correct answer is A. Otitis media. In the following, which is not a sign related to hydrocephalus? A. Bulging fontanelle sign, B. Mason's sign, C. Setting sun sign, D. Homon's sign. And the correct answer is D. Homon's sign. In hydrocephalus, excess fluid that is accumulated causes the fontanelles to bulge. Mason's sign or Mason's sign is a sign used to diagnose hydrocephalus and brain abscesses. In Mason's sign, tapping the skull near the junction of the frontal, temporal and parietal bones will produce cracked pot sound. The sun setting sign is a clinical phenomenon encountered in infants and young children with raised intracranial pressure, whereas Homon's sign is a sign of deep vein thrombosis. Which of the following is not a sign of cerebral palsy? A. Scissors gait, B. Opisthotonous positioning, C. Toe walking, D. Brudinsky sign. And the correct answer is D. Brudinsky sign. Cerebral palsy is a medical condition usually caused by brain damage before or at birth that causes the loss of control of the arms and legs. Cerebral palsy is a brain damage that occurs before a child reaches the age of 5. As such, adults cannot develop this condition. When children with cerebral palsy mature into adults, however, they face new challenges. Scissor gait is a form of gait abnormality primarily associated with spastic cerebral palsy. Opisthotonous positioning is a type of abnormal posture where the back becomes extremely arched due to muscle spasms. Toe walking is when a child walks on their toes and is a sign of cerebral palsy. Brudinsky sign is when the brain damage occurs due to fetal development causes a range of symptoms related to muscle dysfunction. In the following, which is a sign of developmental dysplasia of hip? A. Ortolani sign, B. Brudinsky sign, C. Homon's sign, D. Both B and C. And the correct answer is A. Ortolani sign. A positive Ortolani sign is noted if the hip is dislocated by a characteristic clunk that is felt as the femoral head slides over the posterior rim of the acetabulum and is reduced. Ribbon-like stools is seen in which disease condition? A. Neonatal jaundice, B. Marasmus, C. Hirschsprung's disease, D. Polio. And the correct answer is C. Hirschsprung's disease. In which age group acute rheumatic fever most commonly occur? A. 0 to 5 years, B. 5 to 15 years, C. 2 to 8 years, D. 15 to 20 years. And the correct answer is B. 5 to 15 years. According to msdmanuals.com, first episode of acute rheumatic fever can occur at any age, but occurs most often between 5 to 15 years, which are the peak years of age for streptococcal pharyngitis. Acute rheumatic fever is uncommon before 3 years and after 21 years of age. What do you mean by fetal macrosomia? A. Preterm baby. B. Large sized baby. C. Baby with large sized eyes. D. Baby with malformation of stomach. And the correct answer is B. Large sized baby. The term fetal macrosomia is used to describe a newborn who is significantly larger than average. A baby diagnosed with fetal macrosomia has a birth weight of more than 4 kilograms, regardless of his or her gestational age. What is the full form of IMNCI? A. International Management of Newborn and Childhood Illness. B. Indian Maintenance of Newborn and Child Illness. C. Integrated Management of Newborn and Childhood Illness. D. Incorporated Management of Neonatal and Childhood Illness. And the correct answer is C. Integrated Management of Newborn and Childhood Illness. What is the overall objective of IMNCI? A. To reduce under 5 morbidity and mortality. B. To immunize all the newborns. C. To provide health education to needy. D. To provide training to ANMs. And the correct answer is A. To reduce under 5 morbidity and mortality. The major objectives of IMNCI strategy are to reduce mortality and the frequency and severity of illness and disability and contribute to improve growth and development during the first 5 years of a child's life. Pentavalent vaccine or 5-in-1 vaccine provides protection against A. Diphtheria, pertussis, tetanus, hepatitis B, influenza. B. Polio, tuberculosis, diphtheria, pertussis, tetanus. C. Measles, mumps, rubella, TB, polio. D. Diphtheria, pertussis, tetanus, polio, measles. And the correct answer is A. Diphtheria, pertussis, tetanus, hepatitis B, influenza. Pentavalent vaccine provides protection to a child from 5 life-threatening diseases: diphtheria, pertussis, tetanus, hepatitis B, and influenza. Giving pentavalent vaccine reduces the number of pricks to a child and provides protection from all 5 diseases. Patent ductus arteriosus is an abnormal communication between A. Pulmonary vein and inferior vena cava. B. Pulmonary vein and superior vena cava. C. Pulmonary artery and aorta. D. Pulmonary artery and pulmonary vein. And the correct answer is C. Pulmonary artery and aorta. The ductus arteriosus is a fetal blood vessel that normally closes soon after birth. In a patent ductus arteriosus, the vessel does not close but remains patent, resulting in an abnormal transmission of blood from the aorta to the pulmonary artery. Patent ductus arteriosus is common in newborns with persistent respiratory problems such as hypoxia and has a high occurrence in premature newborns. Premature newborns are more likely to be hypoxic and have patent ductus arteriosus due to underdevelopment of the heart and lungs. What is the main purpose of baby-friendly hospital initiative? A. Immunize all the babies. B. To provide adequate medicine. C. To improve breastfeeding practices. D. To provide family planning services. And the correct answer is C. To improve breastfeeding practices. The Baby Friendly Hospital Initiative is a global effort to implement practices that protect, promote, and support breastfeeding. It aims to ensure that all maternity facilities become centers of breastfeeding support. During fetal life, by which structure blood enters from the right atrium to left atrium? A. Placenta. B. Ductus venosus. C. Foramen ovale. D. Ductus arteriosus. And the correct answer is C. Foramen ovale. In the fetus, there is an opening between the right and left atrium, the foramen ovale, and most of the blood flows from the right into the left atrium, thus bypassing pulmonary circulation. In the following, which is the most common cause of pyoderma in neonates? A. Candida albicans. B. Staphylococcus aureus. C. Clostridium tetani. D. Chlamydia trachomatis. And the correct answer is B. Staphylococcus aureus. Pyoderma means any skin disease with formation of pus. What is first aid? A. Completing a primary survey. B. The first help given to the victim of an accident. C. Assessing a victim's vital signs. D. Treating a victim for shock. And the correct answer is B. The first help given to the victim of an accident. What treatment does a victim whose life-threatening condition is not breathing need? A. The Heimlich maneuver, 2 rescue breaths and CPR. B. Start CPR immediately. C. 12 to 15 rescue breaths per minute and correct CPR. D. You should follow the steps for rescue breathing. And the correct answer is D. You should follow the steps for rescue breathing. Some people are very allergic to insect bites and stings. This condition is called A. Septic shock. B. Cardiac shock. C. Toxic shock syndrome. D. Anaphylactic shock. And the correct answer is D. Anaphylactic shock. The accepted treatment for a femur or thigh bone fracture is A. Place a short padded splint on each side of the leg. B. This type of fracture is best handled by a traction splint applied by those with special training. C. Move the victim before properly applying a leg splint. D. Bind both legs with 2 long splints using 2 cravats, one above and one below the break. And the correct answer is B. This type of fracture is best handled by a traction splint applied by those with special training. To treat a first degree burn, you should A. Apply a good quality burn cream or ointment. B. Clean the area thoroughly with hot soapy water. C. Apply a constricting band between the burn and the heart. D. Apply cool running water until there is little or no remaining pain. And the correct answer is D. Apply cool running water until there is little or no remaining pain. In the event of an accident, a first aider can do all of the following except A. Prescribe and give you medicines to help you recover. B. Move you while you are unconscious. C. Perform CPR. D. Bandage your cuts or wounds. And the correct answer is A. Prescribe and give you medicines to help you recover. You notice that a person has experienced a significant amount of blood loss, has pale skin color and is breathing rapidly. What is most likely the cause? A. Stroke. B. Seizure. C. Shock. D. Low blood sugar. And the correct answer is C. Shock. This is a classic presentation of shock because of blood loss and is a medical emergency. Other causes of shock include infection, severe allergic reactions, severe dehydration, and heart problems. You are treating a pediatric cardiac arrest case. Where do you place the AED pads on the infant? A. Do not use an AED on an infant. B. Upper chest and mid-abdomen. C. Wherever they fit. D. Chest and back. And the correct answer is D. Chest and back. What should a casualty with a severe allergy carry at all times? A. Insulin. B. Acetaminophen. C. Adrenaline. D. Aspirin. And the correct answer is C. Adrenaline, that is EpiPen. Which first aid record must be kept by law in the workplace? A. The day book. B. Individual medical records. C. The accident book. D. Hospital transfer form. And the correct answer is C. The accident book. What should you do for a casualty who has just sprained an ankle? A. Apply local heat. B. Keep exercising it. C. Rest with the leg elevated. D. Massage the swelling. And the correct answer is C. Rest with the leg elevated. What is the treatment for a casualty having an asthma attack? A. Advise the casualty to breathe through their nose. B. Give plenty of water to drink. C. Sit the person comfortably upright. D. Lay the casualty down and raise their legs. And the correct answer is C. Sit the person comfortably upright. You are first on scene and the victim is unresponsive, pulseless and has vomited. You do not feel comfortable performing mouth-to-mouth ventilation. What is the best approach? A. Wait for the ambulance to arrive. B. Compression only CPR. C. Do not initiate resuscitation. D. Wipe off the face or cover with a shirt. And the correct answer is B. Compression only CPR. Compression only CPR has been shown to be effective. Leaving the victim significantly increases mortality. You come upon an unconscious victim with a pulse. They do not appear to be breathing. You are unable to deliver the first rescue breath. What is the next step? A. Begin CPR. B. Abdominal thrust. C. Repeat the head tilt, chin lift maneuver and attempt the rescue breath again. D. Heimlich maneuver. And the correct answer is C. Repeat the head tilt, chin lift maneuver and attempt the rescue breath again. If unable to deliver the first breath, reposition the airway and attempt the breath again. If unable to deliver this breath, it's safe to assume that a foreign body is present and abdominal thrusts are indicated. The Heimlich maneuver is performed on conscious victims. You are eating in a restaurant when a woman cries out. Her 6-month-old child is turning blue around the mouth. He appears to be gagging but is not able to cry or take a breath. An older child had just given him some marbles to play with. What is the next step? A. Begin CPR. B. Deliver back blows and chest thrusts. C. Attempt rescue breaths, then compressions. D. Blind finger sweep. And the correct answer is B. Deliver back blows and chest thrusts. Do not perform a blind finger sweep, as it may push the foreign body deeper into the airway. CPR is not indicated at this point. Red, white, bluish white or greyish yellow patches on someone's ears, nose or cheeks are signs of A. Cold related stress disorder. B. Frostbite. C. Anaphylactic shock. D. Hypothermia. And the correct answer is B. Frostbite. What is the best procedure for treating a patient with a known poisonous snake bite? A. Apply tourniquet, cut the wound or attempt to suck the venom out. B. Treat the victim for shock and continue the planned activity. C. Keep the victim calm, keep the bite location lower than the heart and get medical help immediately. D. Apply ice to the bite area. And the correct answer is C. Keep the victim calm, keep the bite location lower than the heart and get medical help immediately. Keeping the area of snakebite below the heart level slows the spread of venom through the bloodstream. What should you do if you think a victim has serious internal bleeding? A. Call for medical assistance as quickly as possible. B. Apply heat to the injured area. C. Give fluids to replace blood loss. D. Place the victim in a sitting position. And the correct answer is A. Call for medical assistance as quickly as possible. A layperson cannot stop internal bleeding. If extensive bleeding causes lightheadedness or symptoms of shock, the person should be laid down and the legs elevated. One should call for ambulance as quickly as possible. How should you open the airway of an unconscious casualty? A. Head tilt and chin lift. B. Jaw thrust. C. Head tilt and jaw thrust. D. Lift the chin. And the correct answer is A. Head tilt and chin lift. Which of the following can cause a stroke? A. A blood clot in an artery in the brain. B. A blood clot in an artery in the heart. C. A blood clot in an artery in the leg. D. A blood clot in an artery in the lungs. And the correct answer is A. A blood clot in an artery in the brain. Which is the correct ratio of chest compressions to rescue breaths for use in CPR of an adult casualty? A. 2 compressions, 30 rescue breaths. B. 5 compressions, 1 rescue breath. C. 15 compressions, 2 rescue breaths. D. 30 compressions, 2 rescue breaths. And the correct answer is D. 30 compressions, 2 rescue breaths. What should your first action be when treating an electrical burn? A. Ensure that the casualty is still breathing. B. Wash the burn with cold water. C. Check for danger and ensure that contact with the electrical source is broken. D. Check for level of response. And the correct answer is C. Check for danger and ensure that contact with the electrical source is broken. Which test should you use if you suspect that a casualty has had a stroke? A. Face, arms, speech test. B. Alert, voice, pain, unresponsive. C. Response, airway, breathing, circulation. D. Pulse, respiratory rate, temperature. And the correct answer is A. Face, arms, speech test. FAST is an acronym used as a mnemonic to help detect and enhance responsiveness to the needs of a person having a stroke. The acronym stands for F for facial drooping, A for arm weakness, S for speech difficulties, and T for time to call emergency services. How long would you check to see if an unconscious casualty is breathing normally? A. No more than 10 seconds. B. Approximately 10 seconds. C. Exactly 10 seconds. D. At least 10 seconds. And the correct answer is A. No more than 10 seconds. What steps would you take to control bleeding from a nosebleed? A. Sit casualty down, lean forward and pinch soft part of nose. B. Sit casualty down, lean backward and pinch soft part of nose. C. Lie casualty down and pinch soft part of nose. D. Lie casualty down and pinch top of nose. And the correct answer is A. Sit casualty down, lean forward and pinch soft part of nose. What is fainting? A response to fear. B. An unexpected collapse. C. A brief loss of consciousness. D. A sign of flu. And the correct answer is C. A brief loss of consciousness. What is an open fracture? A fracture in which the bone is not visible. B. A fracture in which the bone is exposed as the skin is broken. C. A fracture which causes complications such as a punctured lung. D. A fracture in which the bone has bent and split. And the correct answer is B. A fracture in which the bone is exposed as the skin is broken. What is the best definition of the hurry cases? A. Breathing, bleeding and broken bones. B. Any condition that threatens victim's life. C. Any illness where the victim vomits. D. Any accident requiring arm sling. And the correct answer is B. Any condition that threatens victim's life. Which laboratory test should the nurse monitor for the client receiving the intravenous steroid Solumedrol? A. Sodium level. B. Potassium level. C. Glucose level. D. Hemoglobin level. And the correct answer is C. Glucose level. Injection Solumedrol can cause elevated blood sugar levels in patients with or without diabetes. Because of this reason, blood glucose levels should be monitored for the patient who is receiving intravenous steroid Solumedrol. Ability of a drug to cause fetal abnormalities when administered during pregnancy is known as A. Teratogenic effect, B. Toxic effect, C. Therapeutic effect, D. Healing effect. And the correct answer is A. Teratogenic effect. A teratogen is an agent that can disturb the development of an embryo or fetus. Teratogens halt the pregnancy or produce a congenital malformation, a birth defect. Classes of teratogens include radiation, maternal infections, chemicals, and drugs. Drug used in the treatment of migraine is A. Ergotamine, B. Myospaz, C. Histamine, D. Cerebrolysin. And the correct answer is A. Ergotamine. Antitussive drugs are drugs that inhibit A. Cough, B. Sweating, C. Itching, D. Hunger. And the correct answer is A. Cough. Antitussives are medicines that suppress coughing, also known as cough suppressants. Antitussives are thought to work by inhibiting a coordinating region for coughing located in the brainstem. Penicillin is a drug of which group? A. Antifungal, B. Antibiotic, C. Antihistamine, D. Antiviral. And the correct answer is B. Antibiotic. When assessing a child who is taking phenytoin, the nurse would recognize which of the following findings as a side effect? A. Dry cough, B. Hair loss, C. Nystagmus and gum hyperplasia, D. All of the above. And the correct answer is C. Nystagmus and gum hyperplasia. Nystagmus is an involuntary eye movement which may cause the eye to rapidly move from side to side, up and down or in a circle, and may slightly blur vision. Gum hyperplasia is an overgrowth of gum tissue around the teeth. Substance that neutralize bad odor is called A. Antiseptic, B. Deodorant, C. Detergent, D. Insecticide. And the correct answer is B. Deodorant. Adverse effects of thiazides does not include A. Hypercalcemia, B. Hypouricemia, C. Hyponatremia, D. Hyperlipidemia. And the correct answer is B. Hypouricemia. To promote optimal rest at night in a patient taking a diuretic, the patient should be instructed to A. Restrict daytime fluid intake to prevent nocturia, B. Take the diuretic in the morning with food, C. Drink a hot beverage before bedtime to relax, D. Sleep with the head elevated to promote breathing. And the correct answer is B. Take the diuretic in the morning with food. In the following, which drug is not used in the treatment of allergic conditions? A. Dexamethasone, B. Chlorpheniramine, C. Cetirizine, D. Diamox. And the correct answer is D. Diamox. All of the following are monitored by a nurse when a patient is on diuretics, except A. Assessing weight, B. Restoring fluid intake, C. Maintaining intake output chart, D. Monitoring vital signs. And the correct answer is B. Restoring fluid intake. Which drug is responsible for red man syndrome? A. Linezolid, B. Vancomycin, C. Chloramphenicol, D. Potassium chloride. And the correct answer is B. Vancomycin. Red man syndrome is also called red neck syndrome. The name comes from the red rash that develops on the face, neck, and torso of affected people. Which of the following is a muscle relaxant? A. Injection propofol, B. Injection vecuronium, C. Injection succinylcholine, D. Both B and C. And the correct answer is D. Both B and C. Clotrimazole is a antibacterial drug, B. Antiprotozoal drug, C. Antifungal drug, D. Antiretroviral drug. And the correct answer is C. Antifungal drug. Lead poisoning is also known as A. Plumbism, B. Autism, C. Asterixis, D. Plummer-Vinson syndrome. And the correct answer is A. Plumbism. Lead poisoning is a condition also known as plumbism or painter's colic caused by increased blood serum lead levels. Diarrhea, dementia, and dermatitis are the symptoms of A. Beriberi, B. Pellagra, C. Scurvy, D. Stomatitis. And the correct answer is B. Pellagra. Corneal xerosis and keratomalacia occur due to deficiency of A. Vitamin A, B. Vitamin B, C. Vitamin C, D. Vitamin K. And the correct answer is A. Vitamin A. Vitamin B1 is also known as A. Riboflavin, B. Niacin, C. Pyridoxine, D. Thiamine. And the correct answer is D. Thiamine. Other name of nicotinic acid is A. Thiamine, B. Niacin, C. Riboflavin, D. Pyridoxine. And the correct answer is B. Niacin. Vitamin C is A. Water soluble vitamin, B. Fat soluble vitamin, C. Glucose soluble vitamin, D. Insoluble vitamin. And the correct answer is A. Water soluble vitamin. The mineral essential for the synthesis of thyroid hormone is A. Iron, B. Calcium, C. Iodine, D. Phosphorus. And the correct answer is C. Iodine. Swollen and bleeding gums, delayed wound healing, anemia and weakness are the symptoms of A. Thiamine deficiency, B. Vitamin A deficiency, C. Ascorbic acid deficiency, D. Riboflavin deficiency. And the correct answer is C. Ascorbic acid deficiency. The following diet is recommended for viral hepatitis, jaundice and chronic renal failure. A. High fat diet, B. High protein diet, C. Low protein diet, D. Low calorie diet. And the correct answer is C. Low protein diet. The following food contain first class protein or complete protein. A. Cereals, B. Pulses, C. Eggs, D. Nuts and oil seeds. And the correct answer is C. Eggs. The typical feature of kwashiorkor is A. Growth failure, B. Edema on limbs and face, C. Skin and hair changes, D. All of the above. And the correct answer is D. All of the above. In adult, deficiency of vitamin D may cause A. Scurvy, B. Osteomalacia, C. Rickets, D. Night blindness. And the correct answer is B. Osteomalacia. In young child, deficiency of vitamin D may cause A. Scurvy, B. Osteomalacia, C. Rickets, D. Night blindness. And the correct answer is C. Rickets. Dry beriberi is characterized by involvement of A. Bone, B. Kidney, C. Nerve, D. Heart. And the correct answer is C. Nerve. Wet beriberi is characterized by involvement of A. Bone, B. Kidney, C. Nerve, D. Heart. And the correct answer is D. Heart. Sucrose, lactose, fructose are the examples of A. Sugars, B. Vitamins, C. Minerals, D. Amino acids. And the correct answer is A. Sugars. The vitamin which promotes intestinal absorption of calcium and phosphorus is A. Vitamin A, B. Vitamin C, C. Vitamin D, D. Vitamin E. And the correct answer is C. Vitamin D. In the following, which is not a nutritional deficiency disease? A. Obesity, B. Scurvy, C. Marasmus, D. Kwashiorkor. And the correct answer is A. Obesity. In gastrointestinal tract, dietary fats are emulsified by A. Saliva, B. Gastric juice, C. Bile salts, D. Pancreatic juice. And the correct answer is C. Bile salts. The vitamin that stimulates normal mineralization is A. Vitamin A, B. Vitamin C, C. Vitamin D, D. Vitamin E. And the correct answer is C. Vitamin D. Vitamin A is also known as A. Retinol, B. Scurvy, C. Pyridoxine, D. Tocopherol. And the correct answer is A. Retinol. Vitamin B6 is also known as A. Retinol, B. Scurvy, C. Pyridoxine, D. Tocopherol. And the correct answer is C. Pyridoxine. Goiter occurs due to deficiency of A. Calcium, B. Iodine, C. Phosphorus, D. Iron. And the correct answer is